Hello, welcome back. Now we learn about some important flow charts in subfertility. Okay, so generally we know that people will try with unprotected sexual intercourse for 1 year, or else if 6 cycles of IUI has been done. If is a patient, if a couple came with 1 year of sexual intercourse, or they already tried 6 cycles of IUI, then first step is, what is the first step? They'll ask. You will do a clinical assessment. Clinically, you will go for an assessment and investigations. Okay, what is clinical assessment? All history, examination, and all that, and you'll go for investigation. Okay, if all these things are normal, if all these things are normal, then you will say investigations are done. These are investigations are done. So at that time, you will tell that you go for an expected management for 1 year. Expected management for 1 year, and already 6 cycles are IUI done. Give 6 more cycles of IUI. 6 more cycles of IUI. Okay. So totally here, it will take about total 2 years. How much? Total 2 years. Okay. So if it is not working, she's not getting pregnant, then you'll go for IVF. Why? Because this is known as unexplained infertility. This is known as unexplained infertility. Okay. One important thing is, if age is more than or equal to 36 years, if she's 36 years older, or if she is a known case of cancer, or she has a known other cases of diseases, okay, like if she's having a PCOS or endometriosis, which is affecting the fertility, then you should not wait till 1 year again. You should go for early intervention in this case, okay? You should go for early intervention in this case, okay? This is the thing how to manage a patient who comes with this kind of history, okay? Next. Other thing is, generally we go for ovulation induction. Okay, so ovulation induction, to go for ovulation induction, you should go for ovarian reserve testing. Okay, for ovarian reserve testing, there are low response people, there are high response people. Okay, low response people, high response people. What are the things we'll do? We'll see antral follicular count, AMH, FSH. These are three tests we'll do. Antral follicle count, if it is less than or equal to 4, even if it is 4, it is low response. If it is more than 16, it is high response. Okay. FSH, if it is high, it is low response. Okay. And if it is low, it is good. Okay. AMH is less than 5.4, and if it is more than or equal to 25, it is high response. So how to remember this? So how to remember is a antral follicular count. So 4 for 4. Okay. So if it is less than 4, then it is low response. It should be high. 16 means high response. Even FSH, F for 4. So FSH, I already told FSH should be low. If it is low, it is good response. So if it is low, 4, it is less good response. If it is more, it is low response. AMH, so AMH, so 1, 2, 3, 4, 5. Okay, so 5 less than 5.4 is low response. 5 into 525 is high response. Okay, this is the thing for ovarian reserve testing. Okay, ovarian reserve testing. Next, we learn about this thing. In PCOS, how to go for ovulation induction. What are the different uh, uh, steps in that, included in that. Okay, first thing is, if there is a PCOS patient, first thing you'll go for lifestyle modification. You'll go for lifestyle modification. Okay, so you'll go for clomiphene citrate. What? Clomiphene citrate 50 milligram. 50 milligram you'll give in first cycle. Okay, how, when you'll give? Day 2 to day 6. Day 2 to day 6. If she's ovulating, it's okay. If she's not ovulating in that cycle, then this is the first cycle. Okay, this is the first cycle. Okay, then in second cycle, you'll give clomiphene citrate 100 milligram. 100 milligram in second cycle. If she's not ovulating, okay, then you can give 150 milligram. Okay, in that way. So maximum, what is the maximum dose of clomiphene citrate is 150 milligram. Okay, that's it. And how you'll know whether she's ovulating or not? You'll go for ultrasound folliculometry, where 18 to 20 size of follicle has happened, and there is rupture of that follicle. That means these findings indicates that she ovulated. Okay, so this kind of ovulation induction, these kind of cycles we can give for up to 6 cycles. How many? 6 cycles. Okay. So even though you're giving but there is no ovulation, even though you're giving but there is no ovulation, that indicates that clomiphene resistant. That means clomiphene is not working in them. If there is clomiphene resistant in these people, then you can add metformin. What you can add? You can add metformin, or you can, in case of obese people only, you can add metformin. You can go add gonadotropins. In case of thin PCOS, you can go for ovarian drilling, laparoscopic ovarian drilling. So I'm telling obese. What kind of obesity means? Even though BMI is 25, okay, even though BMI is 25, then also you'll add metformin. Okay, these things. This is the thing which is known as, this table is for clomiphene resistant. Clomiphene resistant. Okay. Now let's learn about clomiphene failure. What is clomiphene failure? We learn that. The same scenario, a PCOS patient came, lifestyle modifications you told already. Now you gave clomiphene citrate 50 milligram and you told folliculometry, you go for folliculometry and you're testing for ultrasound. Okay, there is no ovulation. That means it comes under this. If there is ovulation is present, that means 18 to 20 mm is occurred, ruptured occurred. Okay, ovulation is there. Even then she got period, she didn't become pregnant. Okay, then repeat again 50. Then repeat again 50. In that way, you'll repeat this for 6 cycles. How many cycles? 6 cycles. Okay, even though she's ovulating, but she's not getting pregnant, that means this is known as clomiphene failure. This is known as clomiphene failure. Okay. In case of clomiphene failure, you will directly go for IVF. You go directly go for IVF. This is important. In case of clomiphene failure, you go for directly IVF. Okay. So this table is clomiphene failure. Understood? So um, that's about ovulation induction. Now, next we'll in next video we'll learn about IVF and embryo transfers. But let me once repeat little. Okay, that is first thing. In case of subfertility, if there is 1 year of UPSI and 6 cycles of IUI, first thing you'll go for clinical assessment, history and examination, and investigations. Investigations you'll do. Everything is normal. Investigations are normal. Then maximum for 1 more year or IUI of 6 cycles. If then also she is not getting pregnant, that is unexplained infertility, go for IVF. But some people are there like aged 36 years, cancer patients, PCOS patients, endometriosis patients, then early intervention is required. Okay. Next, for ovarian reserve testing, you'll go for low reserve or low response or high response, andro follicular count of less than 4, and AMH of less than 5.4, FSH of more than 8, 8.9, low response. Okay. Next about clomiphene resistance and clomiphene failure, we already learned. Okay. Okay. This is clomiphene resistant, clomiphene failure. Clomiphene resistance means ovulation is not occurring. Ovulation is not occurring. Okay. There is no rupture. There is no rupture. That is clomiphene resistance. Okay. Maximum you can give for 150. In case of obese, that is BMI 25, you will add metformin, gonadotropins, thin LODs. Okay. Lifestyle modification is the first step. Okay. In case of PCOS and where there is ovulation occurred but she's not getting pregnant. That means ovulation is occurring but she's not getting pregnant. That means clomiphene failure. So remember, clomiphene failure means directly not clomiphene failure. It is pregnancy failure. There is no pregnancy. Okay, that's it. For these people, you will go for IVF. There is no gonadotropin and metformin in this kind of patients. Okay, thank you.